Welcome back inside the Now Morning Show. Now, this week is World Antimicrobial Resistance Awareness Week, and this morning we're putting the Ministry of Health inside your spotlight on Now.
Dr. Rajeev Nagassar joins us this morning in studio. Dr. Nagassar is the chairman of the National Multisectoral Coordinating Committee to combat antimicrobial resistance, as we talk about this week where awareness is key. Good morning, doctor, and welcome to the show.
Good morning.
It's a pleasure to have you with us this morning. Thank you for waking up so early.
Thank you. It's a pleasure being here.
One can only imagine how busy you all are, given the fact that this week is upon us and the sharing of information is so critical. So let's jump straight into the conversation about what antimicrobial resistance is and why it's so important.
Okay, so this week is called World Antimicrobial Resistance Awareness Week, which is a change from previous years where they had World Antibiotic Awareness Week and then World Antimicrobial Awareness Week. So what it is raising awareness of resistance to not just antibiotics, which are the regular drugs we would generally take for infections, but also antifungals, antiparasitics, antivirals, and the resistance that could occur. Because if not, something is not done by the year 2050, and that's if something is not done, we could have 10 million deaths per year. And just in 2019, a study was published in The Lancet showing deaths of at least 1.2 million attributed directly to antimicrobial resistance. Imagine a state where you go into a hospital and you go in for a simple procedure, let's just say procedure, and then you get a resistant infection and you have to stay there for a month, and hopefully the drugs that we have would be able to combat that resistance. That's what we need to think about preventing.
As you mentioned that, this is something we do hear about in conversations with people who say, well, they go to hospital, but they also get sick as well, and they may spend a little bit longer. So this conversation is super important. So how does the National Multisectoral Coordinating Committee work towards combating this resistance in Trinidad and Tobago?
Okay, so one of the ways we work towards it is working in a multisectoral way. So we work in a whole of government, whole of society approach. So we have different representatives on the committee. We have academia, we have the Caribbean Poultry Association, right? We have Ministry of Agriculture, Land and Fisheries, so not just human health, animal health, food and agriculture. And one of the things we've done is we've done studies, and that's how we gathered more information on these topics.
It's interesting that you speak about studies, because I know that's something that definitely is a reference. Where does Trinidad and Tobago stand when it comes to contributing to these studies and even conducting our own studies right here so we can improve?
So Trinidad and Tobago has done a lot of studies on the prevalence of antimicrobial resistance. We actually probably the only Caribbean country that submits data to the World Health Organization Global Antimicrobial Surveillance System. So we contribute data, and it does show that we do have some resistance, some small amount of resistance to what we call last line antibiotics. So when you're generating antibiotic reports and so on, you give out your first line antibiotics, your second line and third line and maybe fourth line antibiotics, and this goes in the increasing order in which you would want to give them. And so the last line are the most expensive or the most broad spectrum, and we are finding resistance to those. Right, and in terms of infection prevention and control, we've also done studies. We've also done work in infection prevention and control in terms of advocacy. So that's what I'm doing here today, right? And it's all aligned to our national strategic plan, which is an approved plan.
So you mentioned that there's resistance detected here in Trinidad and Tobago, and you just went through, let's say, the different categories of antibiotics particularly. Why do we have such a high resistance rate?
Well, I wouldn't say is specifically that we have a high resistance rate. I say we have resistance. And one of the reasons is the use of antibiotics in human health, whether it be getting it from your community pharmacy without a prescription. And I'm not saying that that's necessarily the case, but it could, as one of the known global contributory factors. Taking an antibiotic from your colleague, and that's just human health. There's use of antibiotics as growth promoters in animals, and that could contribute to resistance in animals like poultry, cattle, goats, and so on, right? And when you now take their manure and put it on crops,
Right.
and there's resistance there, you can spread that resistance even more. So that's why you have a whole of government approach and a multisectoral approach to combating it.
So before we get into the multisectoral conversation, let's take it back to community, as you just mentioned there. As we know, sometimes we are guilty of it. We'll say, yeah, well, take this. You're going to
Yeah.
feel better. And many times it doesn't lead into that 7 days of antibiotics that you're supposed to have. And hearing about practices like this, we all are able to pinpoint where we may have gone wrong,
Right.
for want of a better expression. So what role can the community play in ensuring that we do our part to really decrease this resistance?
Well, one of the things we could do is ensure that we complete our, first of all, complete our courses of antibiotics. We don't want to share our antibiotics or keep back antibiotics for maybe, if I'm feeling better now, so if I get sick again, I'll take some more antibiotics later on, right? No, you complete your course of antibiotics. Try to avoid practices. I know pharmacists are responsible. Try to avoid practices like going to your pharmacist and asking for the antibiotics, especially without a doctor's prescription.
So then there are 2 points to that as well. Aside from us trying, or us not going there, we also need to take a look at who we're interacting with and what's being distributed over the counter. Is that correct?
Yes, correct. Yeah.
Okay. Let's talk a little bit about what we can do on an individual level. As we were discussing off air, World Hand Hygiene Awareness Day took place. How has that been incorporated into this week, and how is your committee working towards raising that awareness?
So hand hygiene is one of the cheapest and cost-effective ways to combat resistance, and it's one of the simplest things we could do. And one of the ways we've been doing it is raising awareness at hospitals, raising awareness amongst visitors, monitoring hand hygiene rates in the hospital, and if they're subpar, doing interventions like talking to staff and stuff to improve that hand hygiene rate. And we've done studies that actually show improvements in hand hygiene with things like talking to staff, feeding back the data, and so on.
Now, one of the things you mentioned earlier, and you've just mentioned again, is studies that are taking place in Trinidad and Tobago. And hats off to the committee and all of those who take part. You said, we are one of the few, if not the only one, that actually contributes to the WHO within the region, right? But let's talk about what studies are ongoing now and how it's affecting Trinidad and Tobago and how it's being implemented in the system.
So before we talk about that, I'd just like to say that in terms of infection prevention and control, we were actually first country in the world to roll out infection prevention and control material for persons who clean with WHO material. So we were actually the first country in the world to do that through the Committee on Infection Prevention and Control. How we're rolling out studies. Basically, we are working with the University of the West Indies primarily. I mean, there's some individual studies going on in regional health authorities, but mainly through the University of the West Indies. Right now, we're looking at what is called carbapenem resistance. So resistance to what I told you were the last line antibiotics, the last set of antibiotics. We're looking at the types of resistance chains, and then we're looking at what measures we could take to prevent that: antibiotic stewardship, infection prevention and control, even advocacy. Speaking to the community, telling you don't take your neighbor's antibiotic, just simple things like that. Don't go to the pharmacy and ask for antibiotics. We'd appreciate if and remember, if something is not done, there could be as much as 10 million deaths by 2050 per year. And just recently in 2019, it showed 1.2 million deaths attributed globally to antimicrobial resistance.
Wow.
Yeah.
Definitely something to reflect on as we continue the conversation here this morning. Now, how have you seen, as you mentioned, of course, the hand hygiene studies, for example, that were done, how have you seen that impact the public health system particularly? Did you see any changes?
Well, currently I'm actually doing 2 hand hygiene studies.
Okay.
So I will see the fruits of that soon. But currently we see a reduction in healthcare-associated infections with one study that we have under review. And that hasn't been published as yet, so I don't want to speak too much about it. But I can tell you, with hand hygiene does impact on resistance. And we've seen compliance with healthcare workers being more adherent to washing hands and so on. And those wards that we see increased washing of hands, we see less resistance.
That's wonderful to hear.
Because remember, it goes from your hand to the patient, it goes from your hand to a wall, or from your hand to a bed or a bedpan, and then to another healthcare worker or to a patient, right? So we have to look at how to break the chain of transmission.
Right.
Yeah.
So aside from looking at the public health system, of course, and on an individual level, are there any other focus areas or initiatives that have been taken by academia and by researchers as well to address the resistant bacterial infections?
Well, those are the main focus areas. We've also been developing novel technology with the Faculty of Engineering in terms of hand hygiene. There are research days where they highlight also studies on resistance. So not just consumption of antibiotics, but also the use of antibiotics, resistance mechanisms, and not just in human health, in the environment. So where you may have runoff from plants, whether it be different types of plants.
And these are simple things we don't necessarily think about. Even when it comes to our pets that live with us in our homes, we water our plants, we let it run off. We don't necessarily think about how that can adversely affect us as individuals and the environment as a whole. So we spoke about how the community can get involved. We spoke about what individuals can do. But what about advocacy? Because I noticed you mentioned that a few times in the conversation this morning. How can we now become a part of that advocacy, and what are you and your team doing to ensure that the message is out there?
Well, one of the things we're doing is ensuring and observing the day's World Antimicrobial Resistance Awareness Week, with a stress on the resistance and preventing the resistance. World Hand Hygiene Day, which we observed earlier this day. And then I, as the chairman, would have asked persons within their universities or within their association, the Caribbean Poultry Association, which is animal health, persons and environmental health, to get involved in raising awareness within their areas. And we all need to also work together. So it's not just a one-man thing. It's not just human health alone. Everybody needs to work together.
So also, as you
so
mentioned,
we work together.
Working together is so important, right?
Yeah.
Regardless of where you sit, what position you sit in, at the end of the day, we are all in this together, especially as you shared 2050.
Yeah.
I mean, that's definitely a concern that we all need to pay attention to. So as you sit here now, as chairman, as a doctor, but also just as a human being, what is something that you would like to share with Trinidad and Tobago when it comes to microbial resistance?
Well, just imagine an era where you walk into hospital for a procedure, and then you have to stay months, and worst case scenario, you die, because we know from studies that we've done, and studies that I have done, that persons with resistant infections stay much longer. They usually stay for 3 to 5 days if they don't have a resistant infection, and stay as much as 30 days. If they have a resistant infection. And this is based on actual studies that have been done by myself.
Wow.
Yeah.
Definitely something to think about. As we mentioned a little bit earlier, we do hear those conversations happen, not necessarily out here in the public domain many times, but it is something that we do need to focus on moving forward so we can all do our part as well. Can you tell us what's in the future for the committee working towards 2050?
Right. So we have a national strategic plan to 2027. So we'll be working along that lines of the strategic plan, and one of the areas is raising public awareness, but there are also 4 other areas: infection prevention and control, not just in human health, but biosecurity in animal health. So when you talk about infection prevention and control, it's also called biosecurity in animal health, raising combating antimicrobial resistance through use of antimicrobials, so antimicrobial consumption studies, antimicrobial use studies, and an important aspect would be novel technologies, and that's one of the ways where we could help us, UTT and all the academic institutions, because they're actually involved in research in developing novel technologies.
Wonderful. Well, Dr. Nagassar, Chairman, thank you so much for joining us this morning, and looking forward to seeing your committee work together and achieve these goals so that we can definitely just be better as a nation as well.
Thank you very much.
It's been our pleasure. That's Dr. Rajeev Nagassar, Chairman of the National Multisectoral Coordinating Committee to Combat Antimicrobial Resistance. There's more coming up on your Monday edition of the Now Morning Show. Stay tuned. It was good?
Yeah.